you so much for joining us. So now we're going to go into the closing plenary, which I am particularly excited about because we had a strong start with the governor, and now we get to have a strong ending with a number of legislators and an amazing moderator, Mike Robinson, who will come up and introduce them and lead them in a conversation about what's going on in Hawaii and healthcare policy right now, and how can things be improved and built upon. So thank you so much.
Can you hear me? Okay, now that works. We'll share this one. Okay, so this is it, folks. Closing panel. I'm Mike Robinson, over at Hawaii Pacific Health, Vice President, Government Relations and Community Affairs, and I'm really thrilled to have this group of panelists today. I think it's fitting, given everything that we heard this morning, to close it out in terms of what's happening in our state on the ground. And I think before we get into kind of the policy questions, I want to have an opportunity for each of our legislators to share what they did and who they were as people before they chose public service. I think that's really important. I think it naturally, those experiences will shape their opinions when it comes to health policy. And I think very few of us know that. We only know them as chairs or representatives or senators in a certain district. So I'll start with you, Senator Sam Buenaventura. Tell us about yourself and your career leading up to where you are today.
Aloha. So I'm the state senator for District 2 Puna on the Big Island, where the active volcanoes are, a very rural district. Before I was a legislator, I was a solo practice attorney. So what does that mean in a rural area? Basically, I help out families with children day-to-day, wills, probates, criminal defense. Right before I came into the legislature, I won 3 out of 3 writs of cert. For attorneys, that's a really big thing. That means I argued in front of the Hawaii State Supreme Court, and every single one of my writs of cert, which is usually denied, were accepted. Not only that, I won it. So it was a good way to end my career as a legislator, was that, so that's what I did. So the reason I'm bringing all of this up is because when I became health chair, at the end of the very first session, some advocates came to me and said, you know, we weren't really quite sure about your ability of being health chair. So, just want to let you know, because I was boots on the ground, I was a guardian ad litem, so I know exactly what guardian ad litems do. I was there for foster care. I represented the people who had to deal with state agencies, who had to deal with, because I did personal injury law, I knew a lot of the healthcare stuff. And frankly, after the first session, and Mike, being an advocate, knows, we did quite well. We passed the first interstate compact. I pointed out in one of the brochures out there, that was my bill, the child wellness bill that I introduced, passed and still being used. The general excise tax exemption came through, and now I'm the chair of Health and Human Services, so thank you very much.
Representative Martin.
Oh, I think this one's working. So first of all, we were people before, and we still are people. But my background is actually in public health. So I strayed. So I started out, I did a lot of service provision, mostly third world. That was my focus, international development. I ran a child and infant nutrition program in Guatemala. I worked in Southeast Asia. I got kind of sucked into the whole HIV epidemic, just the timing in my career. That's what was going on then. And then when I came back home to raise my family here, I ended up working at Jabson in their AIDS clinical research program. And then, very worried about climate change, I stopped working in the health area, and I founded a nonprofit focused on climate change education, community forestry, which I still am running concurrently with this job, and was doing that. And just literally a year ago, just after New Year's, I was assigned to be the chair of human services. And so I'm kind of coming back to my past, and although I'm learning, there's so much that I wasn't exposed to as a service delivery or researcher, right? We were not looking at the macro policy level. So a lot of things are new to me, and I'm learning every day, and really feel blessed to be working in an area that is so important to my district. I serve Waimanalo and Kailua. Thank you.
Thank you. Representative Takayama.
Good afternoon, everyone. Happy to be here. We're all products of where we began. I began as a kid growing up in Kalihi Valley, product of public schools, Farrington High School, class of 78. Yeah. But my background is really communications. You know, I'm a communicator. I worked as a news reporter at the Honolulu Star Bulletin when there was real newspapers in those days, and a really good one in the Star Bulletin. Worked as press secretary for Senator Inouye, and worked for 8 years as a news reporter at KHON TV Channel 2. One of the things about being a news reporter is you ask a lot of questions. You go to all places around the state of Hawaii, meet all kinds of people. Asking questions is really a skill that you develop as a reporter. We have one mouth and 2 ears to be used proportionately, and so you listen to a lot of people and the problems they face in our community. You know, I can't tell you how many parents who've lost their loved ones due to whatever, drunk driving or some even worse tragedy in the community, and you know, talk to people who are on the streets, living on the streets, trying to get into clean and sober housing. So the whole range of community concerns I learn as a reporter set me in when I reached age 60, I thought, okay, time for another career. And I decided to enter elected politics. So I was fortunate enough to be elected to the State House and find myself 12 years later as chairman of the House Health Committee. And I'll be honest, I've chaired other committees in the House, never Health Committee. So it's a learning experience for me. I'm looking forward to turning all my problems over to Joy and Lisa, and not have to face too many in the House, but I know that's not going to happen. So thank you all very much.
That's funny, Greg. I know that amongst the lobbying advocate committee, we always try and guess who is crazy enough to chair health or human services from year to year. So we're really happy that you folks have courageously taken on those roles. I think the other kind of interesting aspect of each of you is that you come from very diverse communities, right, which I think is really important when it comes to healthcare. Just, separate from your role as chair, can you kind of share with us from your different communities how the issues of health is bubbling up in the constituents that you serve that are maybe particular to your area that might be different than your colleagues? So maybe I'll start with you, Senator, over on the Big Island on Puna.
So thank you very much. So when I first got into office, the need for urgent care and ER services in my community is really big. Just for those who don't know the Puna district, it is the size of all of Oahu, okay, with a sparse population, but all of Oahu and no hospital. So think about where people in Kalapana having to go 2 hours to an emergency room. About 10, 15 years ago, I don't know if you folks, well, the case has sort of bubbled up last couple of years later, the Dana Ireland case. People have heard about the defendants being acquitted. But what people didn't realize was That was an assault victim in Pune where the ambulance kind of refused to go to at a time when she was still alive because the roads were so bad. Okay, and when they finally got her, and they took her to the hospital, she was still alive when she was in the hospital, but the blood loss was such that she couldn't be, she died on the operating room table. But had there been an emergency room or at least paved roads to that area, she would have been at least been able to go to the ER and have been, hopefully, would still be alive and be with us today. But that is the kind of thing that characterizes my district. So when I start talking about roads are super important. When an ambulance cannot get to you, when a fire department vehicle cannot get to your house because of the roads, it's super important. So I'm thankful that since I've been in office, more health services is coming to the Big Island. I saw Elena Kabatu back there for HHS. Yes. So thank you, Hawaii Health Systems has expanded medical services there. I can't help but think that having a health chair in Pune had something to do with it. But yeah, we're getting there. And so that is the kind of thing that I don't think people quite realize, that if it takes you 2 hours to get to an ER, it's a life and death situation, right? So thank you.
Representative Martin, last night we were talking about how diverse your district is, and I thought that was really fascinating how you were breaking that down. If you want to share a little bit about that, that's a big part of this.
Okay, so I represent Waimanalo and Kailua. So we have, it's a very, very diverse district, a beautiful district. I'm so lucky to live there. But we have Hawaiian Homestead, we have ag lots, we have beachside communities, we have kind of middle-class residential neighborhoods. So we have a little bit of everything. And hearing the senator speak, I'm reflecting how incredibly fortunate we are, all of us, regardless of who you are in that community, to have access to healthcare easily available, right? We had Adventist Health, Castle Health Hospital there. We have Waimanalo Health Center. So we really do have access. I whacked my head playing pickleball last week, and I got a big cut, and I had to go in for 4 staples, and I had choices. And I actually ended up going to urgent care thinking that I'd be less late for my caucus meeting. But, so there's a lot of access to healthcare there. It doesn't mean that we have a uniformly healthy population, right? We have all the health disparities that you see with the Native Hawaiian community impact us. And I'm so grateful for the innovative services by the healthcare center that they're providing. We also have, an impact of having one of the 2 psychiatric facilities on Oahu at Castle. When anybody has an MH1 call, so when police are going for a mental health call in rural Oahu, anywhere from the North Shore to the west side to the east side, they come to Castle. And sometimes that's where they stay. And we end up importing a lot of homeless people with mental health problems into our community. And so that is a huge issue for my community, is mental health, homelessness, not blaming it all on that pipeline, but definitely that's a big issue for my community.
And Rep. Takayama in District 34?
Yes, District 34 is Pearl City. Now, within my lifetime, I'm not sure how many of your lifetimes, Pearl City, Aiea, was sugarcane fields. In the 60s, first houses, single-family houses, started being built, subdivisions after subdivisions. So many of the residents moved in the 60s as young working couples in their 20s, and they're still there. Pearl City is mostly a place of single-family homes, and the people who originally moved there are now in their, quick math, 80s or so, and they are aging in place. Many of them, all my neighbors, have multi-generational families living with them, grandparents and their children and their grandchildren, all living in the same household. And what I'm leading to is the issue of long-term care and the need to support our family caregivers who provide much of that care at no cost to the rest of the community, but at great cost to them. I mean, the average family caregiver is a professional woman in her 50s. For some reason, it always falls to women to take care of their parents and sometimes even their in-laws. And, you know, that can be a tremendous burden. And when you add to that Alzheimer's and dementia as things that to worry about, it's a great burden. My own father suffered from dementia before he died. And for years, my brother, who was a retired school teacher, fortunately was able to live with them and take care of many of his needs. But in those days, and I'm talking about 20 years ago, Alzheimer's was relatively new, and there weren't a lot of resources for families who were dealing with someone who was dealing with dementia or Alzheimer's. And so it was a struggle for him and me in part, but glad to say that the work of the state and along with the Alzheimer's Association has made it a lot easier. It's still stressful, but a lot easier. But then again, we haven't really dealt with the problem of caregiving. And I think it's time that we take a look at maybe tax credits for family caregivers to help alleviate the burden. Because in most cases, those who provide caregiving have to take leave from their jobs or quit their jobs altogether. So that's one of the issues I think I'm looking forward to in this coming session and probably sessions beyond.
Thank you. So this morning we had an opportunity to hear what the governor's priorities were going into the 2025 session. I wanted to give each of you the opportunity to kind of share. I know it's really early in the process, that even started yet. You know, maybe if you want to talk about maybe a big success that you had last year so that our audience understands the good work that you've done. You mentioned a few, Senator. But maybe if you could mention or talk about what are, you know, maybe one or two things that you would feel that the 2025 session was a successful session if you were to pass X, Y, or address a particular issue. So I'll start first with you, Senator, if you want to kick that off.
So my biggest priority, and I've mentioned this, it's probably something you folks are not aware of, is the overcrowding at the Hawaii State Hospital. We don't have, especially with the closure of Palimomi, we don't really have a residential psychiatric facility. So a sort of success of mine, and I'm only saying it as sort of a success because really the NGO who ran with my nudge, you know, blew it up and did good things with it, is supportive housing on the Big Island. And she told me that she credited me with my nudge 2 years ago, and Dan Brinkman of Hilo Medical Center came to me and I said, you know, we don't have any psychiatric beds on the Big Island. And the judges were telling me, it doesn't make sense to go ship people over to Honolulu. And when Kenny Fink and Marion Suji tells me that it costs $900 per day to house one person in Hawaii State Hospital, it really doesn't make sense to put them into Hawaii State Hospital. So I nudged Dan Brinkman and goes, get me some beds. And he came up with a formula about 9, but he could probably provide 9 beds, and he partnered with Hope Services right there and then. Apparently when I did this nudge, there was an event right before session started, and they started working on it. And just yesterday, I was invited to a grand opening of supportive housing that housed 6 high acuity, but still mentally challenged individuals because of a partnership with Ohana Health Plans. And that was the latest thing. And I talked to Aloha Care last night, and they haven't heard of it. It's really, to me, kind of groundbreaking when an NGO took the ball and with Hilo Medical Center, Benioff Medical Center, I don't know what it's called now, but basically, took the ball to create supportive housing. They said, well, heck, if we could do it with Hilo Medical Center, we could do it with Ohana Health Plans. Took another 6 beds, and I think there was 9 beds with Hilo Medical Center, another 6 beds that's here, and another 5 that's on the way. And I've talked to Aloha Care, and they're interested to hear the partnerships. So it's monies like that that's not coming from the state government, sort of. I mean, I'm sure there is some, in funding but at least we're not spending $900 per day for this 20 individuals who don't need the kind of level of care that would be overcrowding our Hawaii State Hospital system. And so that's my priority. That is a success, because according to Marion Tsuji's statistics, I have basically created, not me, but Hope Services, along with a collaboration with Hilo Medical Center and Ohana Health Plans, has created 20 beds that didn't exist prior to my nudging and their innovation for that. And I think that which is over double, triple what is projected need. So if we could use that model for Honolulu, because right now the legislative model is providing supportive housing to to DHS. And from when I talk to the homeless coordinator, right now the supportive housing monies we've set aside is only going to Metro Honolulu and one provider. So we are not, at least in Honolulu, we have not nudged the NGOs enough to do the kind of collaboration that the Big Island has been able to do. So if we could do that, we could hopefully bring down some of the population for Hawaii State Hospital. And I know it's a different kind of population. I know it's mostly forensic, but I'm working with Attorney Generals to hopefully the petty misdemeanors, the low acuity, low violent people, get them out of the $900 per person facility over to long-term care housing. And hopefully we could reduce the monies that the state is paying and be able to house behavioral health people. And I listened a little bit to the Maui people and their challenges in Maui, but I'm super hopeful. When I went to visit Maui a couple of months ago, HHFDC, along with the County of Maui, bought a hotel, Maui Sun, and it is housing survivors, it is housing medical personnel, and hopefully, as soon as the survivors move out, we can use that as a model for workforce housing for medical personnel so that we can bring more people in. And Department of Transportation, when I talked to Ed Sniffen, he, in collaboration with CNHA, had created around 9 or so more temporary housing for the survivors, along with what the DHS and FEMA have done. So collaborations are out there, and I'm hopeful that we could address these shortages sooner rather than later. Thank you.
Before we get to you, Representative Martin, I'm going to ask Greg to share what your priorities are, only because of your background in this space as well.
Let me start by saying, even the theme of this conference is state of reform. But I think the more I look at our state healthcare system, the more I'm impressed with how strong it actually is. We're talking about a state in which more than 94% of our population has health insurance, and in which the percentage that we pay for our health costs, even though the price of eggs and milk and everything else is through the roof, our percentage of income that we devote to healthcare coverage compares pretty favorably to most of the other states. And the outcomes as far as Hawaii is concerned are among the best in the country. And so we have a lot to be proud of in terms of our current healthcare system. But that being said, as you heard earlier today, there are things we need to do to correct disparities, especially among the Native Hawaiian and Pacific Island population, as well as I said earlier, dealing with some of the aging issues we have in the community. Having said that, this morning I was at a hearing at which Director Fink talked about a crisis that we have in our public schools, and that deals with falling vaccination rates. The rate of vaccination at which there is herd immunity for measles is 95%. The percentage we currently have in all of our schools in Hawaii is far below that, and some particular schools as much as 20% below that rate. And so it's a cause of concern. And what's rapidly rising are the number of exemptions that are provided to parents of children on religious grounds. So one of the proposals that Governor Green will be providing to us in the legislature in this session is to do away with the religious exemption for vaccinations. And that, no doubt, will create a firestorm of protests at the Capitol. But I'm pretty sure that's something we need to do. The fact that measles, polio, other diseases may resurge is a threat not only to students who, for medical reasons, may not be able to be vaccinated, but for adults too. I mean, we've been vaccinated, but that's not total protection because it wears off after decades. And so adults could be susceptible to diseases like that as well. So that's a cause of concern, one of my top priorities this coming session.
Representative Martin, do you want to share a success from last session and maybe what your priorities are as it looks today?
First, I want to share some gratitude. That's going to be tough, and I'm really glad that Greg is the chair of health in the House this year, because that's not going to be our only tough battle, contentious, and more than deep background in health, you need a strong leader, somebody who can handle that pressure that we're going to see. So I'm really glad that he took on that role this time around. Yeah, thank you. I'm a big proponent of vaccines. I was actually in the Pfizer trial, and it was so bizarre because I had worked in a clinical trials program. I never thought I would be a participant, and really did a lot of pop-up vaccine clinics in my district when I first started. And so yeah, I'm glad to see it. Going door to door. I had people tell me that they moved here specifically because California no longer had a religious exemption. So I guess the reason I'm saying this is we're going to need your help because we're going to have a lot of opposition. So we definitely need to hear from proponents of vaccine safety as well, right? Don't leave us on our own. So in terms of some successes, before I came to these committees, I was already very concerned with homelessness. Because I'm part of my community, they are concerned, I'm concerned too. And I'm glad with the progress we've made, like the state-funded, the Ebola Crisis Center, and created an opportunity for police officers to have a third option instead of just taking people to jail or to ER. The Crisis Center becomes a third alternative, hopefully with more appropriate care, getting people into, passed on into something that might help them. So I think that was a success. We raised some of our Medicaid rates that really needed to be raised, and as a body, that was a success. There's one that didn't get raised last year. I want to put it on your radar, so again, you can support this year. That's for in-home care, which I understand from speaking to people today, they have great data on how much we save when we are able to provide that Medicaid rates, for in-home care. We have very, very low usage of that service in our state because very few providers are willing to provide it at that price point. And I know most of us would love to age in our home with that help. Some other things, just because I'd love to have your support during session, I'll just briefly mention a few. So one is prior authorization, doing a reform of how that works. First, I heard from our community physicians how important that was to them. Turns out Jack was working on that as well. And so I'm hoping to see some reform. And I believe that we have, we may not have the opposition that people might assume there would be from insurance providers. So that's very hopeful. Another one is an insurance mandate for traditional healing in my health center, as well as many of the other health centers we're doing traditional Hawaiian medicine. And it's very helpful for my community. Often the same goals of diet change, exercise, meditation, all these lifestyle changes that we need for our chronic illnesses may be better with that packaging, right? The same goals, a different way of getting there, and might be more effective for communities like mine. I have a bunch of bills around improving the child welfare system, which has been something that Senator San Buenaventura has worked on, as well as myself over years. And then just a lot of things that we've been talking about. I know it's not social determinants of health anymore, it's medically related social something. But poverty, housing, the family caregiver insurance that Greg was talking about, that's part of our Keiki Caucus package. Those kinds of things, just hoping the larger umbrella.
So, one of the kind of ethos of the state of reform is that this conference is set up to be a solutions-based forum. If you notice, in every one of our forums, it's not just folks grousing about how bad things are, where there are actually people that are on panels talking about how they are overcoming barriers that are in front of them. So one of the things that we've seen, I'm going to cite the Alice report, AU David, that just came out last week, is we have seen time and time that we have a pretty fragile ecosystem here in Hawaii. We still have about 40% of the households that are living at an Alice level or below. The report also highlighted that 37% of residents here know somebody that have thought of leaving Hawaii because of the cost of living. And we're at a point now where there are more Native Hawaiians that live on the continent than in the state of Hawaii, which was pretty alarming when I first heard that. So given all of that, and given that these themes of workforce, affordability, particularly housing, seems to come up again and again and again, kind of in the spirit of state of reform and being a very solution-based forum, can each of you share what makes you feel optimistic that in 2025, the conditions or solutions are such that we have a chance to kind of break out of this cycle of kind of bad news when it comes to the social terms of health and where many of our residents, unfortunately, are at? I know that's a mouthful, but I'll start with you, Senator. What makes 2025 special and what gets you excited that maybe we can do something this year?
So thank you very much. And I have shared a little bit earlier about the supportive housing increases based upon collaborations. And so that's the kind of stuff that has me excited and hopeful. Prior to even before the Maui wildfires, people were saying about the need for affordable housing. People were saying about the need for workforce housing. And we were basically funding the county initiatives and the like, but it was, and private developers with state tax credit monies to HHFDC. The fact that HHFDC is now funding actual developments directly, like I said, we bought a Maui hotel. I've never heard of that. And
A nice one too.
It's not even a dilapidated hotel. I remember staying in that hotel a couple of years ago. It's nice, it had conference rooms and the potential for preschool down and elder care housing below. The potential is huge as soon as the survivors go out for workforce housing. The fact that the county, at least on the Big Island, is talking about partnering with some state and to create more workforce housing. The fact that, and And I don't know whether or not Debbie Moriwaki, who is first deputy of Department of Health, shared this. Morikawa. There's a Morikawa and Moriwaki in the legislature, and I never know which one she was. Sorry about that. Sorry, Debbie. Debbie knows I always butcher her last name because I don't know which one. Didn't share with with Representative Takayama was that she has this holistic idea of bringing in more CNAs, foreign CNAs, to increase the J1 visa, because we know that's the reason I'm super hopeful, because I'm hearing from the community colleges. I mean, last year, I don't know if a state reform, but it was another panel where we talked about state incentives to bring in more to address the shortages. And we passed the compact, the interstate compact. We were the only state that did the loan repayment. We were the only state for loan repayment, and not only for medical doctors, for the entire medical profession. That's huge. And we actually, within just a couple of years, reduced our medical shortage from 20% down to 16%, and it just started. So it's huge. And so for Debbie to come up with this idea to potentially, hopefully partnering with our feds to bring in, hopefully, our CNA to decrease the shortages. So I'm super pumped. I'm super pumped, especially when I hear about the collaborations with Ohana Health Plans and hopefully with Aloha Care and hopefully with HMSA soon to create more supportive housing. I'm super pumped that people are thinking beyond the box other than interstate compacts, because I go to these federal, NCSL, CSG, and everyone has a workforce shortage. But we're the only state that actually had the loan repayment program, so we were actually able to reduce it. But it's like robbing Peter to pay Paul, right? So unless we think out of the box of bringing foreigners in, I hate to say it, and I know it's not the right administration to do that, but Debbie's idea is to train them in the foreign country, specifically the Philippines, because they have already a number of nursing colleges there. They speak English, and with the J1 visa, you limit their time here, and with a potential for workforce housing, we can actually address a number of these workforce issues, hopefully in the next 5 to 10 years. I was not that hopeful 2 years ago. Now I am. I could see the light ahead of the tunnel. So I thank you folks. I thank you folks for coming here, because like I said, it's a kind of innovations that we didn't think about. I would never have thought Hope Services would collaborate with a health plan to come up with supportive housing. So we need those kind of innovative ideas. Sorry.
Representative Takayama?
Well, Joy touched on one of the things I was going to talk about, which is the loan repayment program, which started 2 years ago, funded with $10 million. In the next 2 years, we'll be asking for $15 million in each of the next 2 years, so $30 million altogether. And for those of you who aren't that familiar with it, what it does is provide those in the health professions, physicians, nurses, social workers, medical assistants, a whole range of professions, provides them the opportunity to have their the loans forgiven for the loans that they took out for tuition to pay for their training, up to $50,000 forgiven. So it's a tremendous opportunity for us to gain from them, because it requires that they serve for 2 years in a rural area, which in Hawaii is almost everywhere. And so it's a great opportunity to, as Joy said, reduce the workforce shortage in Hawaii. So I'm looking forward to supporting that, and hope all of you will as well. When Mike talked about people moving to the mainland, he's talking about 2 out of my 3 daughters who went to the mainland for college and never came back. And so one is living in Oregon and one in Virginia, and the worst thing about it is that my two granddaughters are living in Oregon, and I have to go there or have them come here to visit. So it's something that each of us personally feels, and something that I certainly want to do my best to resolve.
Representative Martin?
So you asked what gives us hope about these kind of general social services, and I'd say that our new speaker is a planner by trade, very, very interested in housing and housing development. And we have in our majority caucus package, we have a bill to support the governor's initiative on Kauhale and expand upon it, bringing in HHFDC housing developers with more knowledge of construction and more access to federal loans. So I think, there's a huge focus on that, and not just workforce housing, but long-term housing with wraparound services, because the truth is a lot of people are going to need that forever. Not everybody can go to an emergency shelter and then be independent, right? So I think we have awareness in our House leadership. It's a priority, and so that gives me hope. Thank you.
So there was a lot of discussion this morning about the significant changes that are occurring federally with the new Trump administration coming in. And I think for a lot of folks here that follow the political scene here, there was a significant sea change here within our legislature, both in the transition of leadership in the House, but I think, just as interestingly, we had 11 new House members in this last election cycle, another 18 in the prior election. So there's something like, 29 new members in the House, and a significant number of an increase percentage-wise in both the House and the Senate in terms of the number of Republican legislators. So it's a little bit new for someone who's been in this space for some time. It's an interesting environment to be in. I wanted to get each of your perspectives as committee chairs on what that means in terms of your role as committee chairs with this new transition of both newly elected officials, and then not that the balance of Republicans and Democrats have shifted so significantly, but it is becoming probably more reality. And get your comments on whether you're seeing that type of red wave occurring in the houses that you serve. And actually, Rep. Takiam, I'll start with you, because you are probably been in the office the longest and have a very long perspective on this.
Yeah, this year, all of us politicians sign waive. And so this year I decided to sign waive on behalf of not just myself, but also held signs for Kamala Harris. And Pearl City is a very democratic, with a big D, district. But I was surprised by the kind of reaction I got, which was how strongly negative the reaction was to anyone holding a Harris sign. It was something I had never seen before in Pearl City, honestly, in the years I've been there. And so it was something that alerted me to the fact that, we have to deal with the fact that more than half of the country is Republican voting, and that the Trump administration will probably bring in changes that we have to deal with. Now, as someone who's followed Donald Trump for most of his political career, I know that what Donald Trump says and what he does are often two different things. But some of the things he says are alarming to me, whether you deal with vaccination and who he may appoint as health secretary, to also the fact that he may restrict abortion medication shipments between states, which means we need to stockpile, and which Department of Health is proposing to do, those medications. A whole gamut of things may happen that we need to watch carefully. And so that, to me, is the real change that I'm concerned about, because it directly affects us in Hawaii. And so that's something that we all should be concerned about and be very careful watching, not just in Washington, but here at home as well.
Yeah, I just want to stay with the House for a bit. Representative Martin, do you want to comment on the demographic changes you've seen in your chamber?
Well, the impact on my committee is last year I had one Republican in my committee, and I'm going to have two. So I don't know. It's not a huge impact. I'd say it at this yet. At the national level, it's terrifying, but not. I don't think it has much of an impact here at the state level. It could change in the future, but not now.
Senator, in the Senate chamber?
Okay, so we got one extra Republican. So at a time when I first got in, we had one, Kurt Favela, and then there was two, Brenton Awan. Now we have three, Samantha DeCourt. So what does that mean? Well, now I have an extra committee because we can't, the majority needs to be in leadership. So I am vice chair of Hawaiian Affairs, and I've never had that committee before. But it's 40% of my district is Hawaiian. So it resonates with my kuleana. So I agree with Rep. Takayama. What he says and what he does are two different things. What I'd like to point out was 4 years ago, I mean, we voted for Clinton, right? But when we had the disasters, the 2018, we had 3 national disasters in 2018. We had the Kauai floods. We had my district with the lava. We had Hurricane Lane. Right after the lava, we had Hurricane Lane that came through. And the next year, we had the Poly Highway. As soon as we reached the national threshold, Donald Trump signed it. It was on his table, he signed it, and he gave us the money. So I'm hoping he won't be as vindictive as he says, because we did vote Democrat. And we do have a governor who is out there testifying against his HHS nominee. So I am hopeful. But I am for Health and Human Services, I have past Department of Human Services. One of his big initiatives was Family First. Let's put a lot of emphasis on Family First so that let's get some federal funding in that way in case they cut the other funding. I think the biggest impact for us is going to be his immigration. Somebody pointed out, a news person pointed out, we're talking about 50,000, potentially 50,000 illegals, as well as, because he intends to go after the refugees too, right? At least he backed out on the DACAs, but he intends to go after the Ukrainian refugees too. And when we start, those of you who are in long-term care know that we've been using some of these refugees as CNAs. And all of a sudden, we're not gonna have that workforce potentially. And that was what happened last time. He actually deported a Kona coffee farmer who had 300 employees. Okay, so he was a successful Kona coffee farmer. So the impact, I think, with his immigration policies is going to be huge. So that's what I'm concerned about.
So we're going to be turning over to audience questions, but before we do that, as moderator, I have one question. I'll take the license to do that. Question I have is, we've experienced some unprecedented disputes between hospital providers, healthcare providers, and labor. Particularly, you've seen in the news cycle, there have been strikes, labor disputes. We have a strike going on just today, actually, over at Wilcox. Queens just settled their strike yesterday. We had active labor negotiations with the unions at Kapi'olani Medical Center that lasted about close to a year. And then Maui just settled their labor dispute. And so that seems to be a more frequent occurrence than what I can remember, where we have been on the brink of a statewide nursing strike, and it's come to the feet at the legislators, unfortunately, last session. Without getting into the specifics of any bill, I've been hearing there's multiple nurse staffing ratio bills that are going to be introduced this year. I'd be curious to know what your philosophical position is on what the state's role should be in the mandating of staffing ratios that are fixed in statute when it involves the negotiation of two private parties, being one a healthcare system and a private union. So I know, Senator, you had a really tough, contentious hearing that a lot of us had sat through here that are in this room, and I wanted to get your perspective going into 2025 now that we've successfully had some negotiations that have closed with both parties being happy with the outcome.
You know, surprisingly, right before I came here, I got an LRB memo report on nurse staffing ratios and what's going on among the state. Philosophically, I'm for them negotiating amongst themselves, and that's what I said at the hearing. So I told them, work it out, have a working group. And the salaries are huge from what I've heard. And so basically, because I feel for the nurses, okay? I mean, COVID decimated a number of our nursing shortage. I mean, increased, exacerbated our nursing shortage. The amount of hours that they are working are longer. Stressors are there, but I don't understand how you can tell patients not to go to the hospitals to keep the staffing ratio fixed. And so I want to see how the other states are doing it. We had the nurse compact bill come through, and maybe that's one way to do it. But like I said, it's like robbing Peter to pay Paul. I mean, they have nursing shortages throughout the country. So basically what we're doing is we're trying to outbid the other states, which to me is a losing proposition. And I know we are growing them. I know Hilo Medical Center, I keep pointing them out. They grab as many nurses that graduate from Hilo and the community colleges as fast as they can graduate and get them certified soon. And as far as I can tell, they're like the most efficient in grabbing those graduates than any other hospital has been able to do it. I know Kona Hospital wishes that they have the ability to do as well as Hilo Medical Center does. And I know Queens and Castle, I mean, you folks are fighting only with Manoa graduates, so good luck to you folks. But I mean, we are, hopefully with those types of loan repayment programs, we can increase the nursing so that we don't have the kind of backbreaking hours that the nurses are going through, because money isn't enough. You know, when you're telling them their quality of life isn't, that they won't be able to see their kids and that sort of thing, so.
Representative, you are the new chair of health. You will be dealing with this issue for first impressions this session. You'd like to get your thoughts on this?
Well, first of all, I think, as Joyce says, it's a workforce shortage issue when it boils down to it. We just need to produce more nurses. And like we said, the loan repayment program, at the rate of $15 million a year, would produce between 250 to maybe 300 health professionals. And that's the way to gradually solve the problem. California has a nursing ratio law. And what we've heard from those who work there is that if a hospital cannot staff adequately a unit, then they'll shut it down. Now in California, you can drive over to the next county, maybe 15, 20 minutes away to another hospital. Try doing that on Maui or Kauai. There's no other place to go. And so that's one of the consequences we need to consider in considering a nursing staffing ratio law.
Representative Martin?
I'd say it's not the state's role to mandate exactly how that goes. But I do have a lot of concerns about our rural areas or an unexpected event like the firework tragedy on New Year's, where you don't want to turn patients away because you have an inflexible requirement.
Thank you. So we'll turn it over. We have a few minutes for patient. I know we're going a little bit over schedule, but we're fortunate to have this audience here. So I think there's a mic going around the room if anybody wants to ask a question of our legislators from the audience. Well, there you have it, folks. Well, thank you very much, and please a round of applause for our legislators.